Okay, we'll get started, everyone. Thank you so much for tuning into today's webinar hosted by the STEEP Superfund Research Program. Our webinar series will focus on PFAS on Cape Cod and how we can connect communities with scientists for solutions. I'm Laurel Schaider. I'm a senior scientist at Silent Spring Institute and a member of the research team for STEEP, and I'll be moderating today's webinar. STEEP stands for Sources, Transport, Exposure, and Effects of PFAS. It's funded by the National Institute of Environmental Health Sciences, and STEEP is led by the University of Rhode Island, working together with researchers from Harvard University and Silent Spring Institute. The goals for our webinar series are to share findings of STEEP research with members of the community on Cape Cod and beyond, to elevate the voices of community leaders on Cape Cod who are working to address the many challenges related to PFAS, and to share examples of how researchers and communities can work together to find solutions. Before we get started, just a couple of housekeeping items. Our two speakers will be available to take questions at the end of the presentations. Please do type in any questions that you have into the Q&A. You can also look at other people's questions and upvote the ones that you're most interested in hearing the answers to. We will attempt to get to as many questions as we can today. We also received some questions from attendees when they registered. If we don't get to your question, we will try to provide answers after the webinar. We will be sending out a general email, so we can include some answers to common questions there, as well as links to relevant resources. So I am excited for today's discussion with two great presenters. Dr. Rainer Lohmann is a professor at the University of Rhode Island and leader of the STEEP project, and Chris Powicki, who's the chair of the Sierra Club Cape Cod group and Cape Cod and the Islands group based on Cape Cod in Massachusetts. So with that, I'm going to stop sharing and introduce Rainer Lohmann. So Rainer is a professor at the University of Rhode Island's Graduate School of Oceanography. He obtained a degree in chemical engineering and a doctorate in environmental science. He's the director of STEEP, and his research focuses on the detection, bioaccumulation, transport, and fate of anthropogenic pollutants in the environment. And he's pioneered methods and passive samplers in the process. Since 2000, he has published over 200 publications and book chapters. He was a member of US EPA's Board of Scientific Counselors from 2017 to 2023, and he serves as an editor for the journal Environmental Toxicology and Chemistry. He was awarded a Fulbright Fellowship as part of the Fulbright Arctic Initiative 3 in 2020 and an Alexander von Humboldt Fellowship in 2011. So with that, I will hand it over to Rainer.
Thanks, Laurel, and thanks for all those online. Yes, my name is Rainer Lohmann. I work at the University of Rhode Island, and I'm presenting work related to STEEP, and it kind of combines two communities that we care about strongly, and that is, on the one hand, of course, Cape Cod, that is on the picture on the bottom right, and the Faroe Islands on the bottom left. And this particular work was about trying to understand exposure to PFAS inside homes on the Faroe Islands, and Melissa Woodward was doing all the work, and then eventually I'll try to relate that to what might be relevant for the Cape. So the STEEP Superfund Research Project is funded by the National Institute of Environmental Health Sciences. It's a Superfund research project, so that means always they combine biomedical research. In our case, that is Philippe Grandjean's work on epidemiological risks of children and how the development is impacted by pollutants such as PFAS, in our case, toxicology of PFAS in rodents and cell bind assays, and environmental engineering research. And some of that will be featured in the next webinar, where Elsie Sunderland's group has worked on the plume of PFAS in the groundwater of the Cape and on presence of PFAS in some fish. Our work at URI has to deal a lot with detection of PFAS in various media and understanding bioaccumulation. But that's only half of the work. So beyond the science, we have a training core. Several of the grad students have been on the Cape for various events. We work on data management. And most importantly for today, we have a community engagement core that is led by Laurel Schaider from Silent Spring, and of course, Emily Diamond from URI. And we try to be present on the Cape for this work. And lastly, we have a research translation core. They do all kinds of fancy things, including taking care of our website, tip cards, and other information to be shared with the public at large. And you can find some more at uri.edu/steep. So going to PFAS, quick reminder that I think we've since learned once we make chemicals that are very long-lived, they don't just cease to exist just because we don't use them anymore, but they will keep recycling in the environment, and that kind of haunts us in the long term. So of course, initially we produce these chemicals for various products and applications, be that firefighting foam, be that textiles or carpets that are stain repellent, could also be the takeout boxes that we used, or unfortunately cosmetics. But once we've kind of taken care of the use of these products, they either end up in a landfill, they might be in the sewage, and then eventually they'll be discharged to coastal water bodies. Sometimes biosolids have been applied in agriculture. So they keep being present in the environment. And then we have another route of exposure that is through our food, of course, the drinking water, but also from the products that are in the homes, indirectly typically. And that was basically the interest that we had for our study. So maybe for background, big question that of course everybody wants to know is, how am I exposed? And of course, it always depends very much on individual circumstances. Where do you live? What you eat? What your home is like? So all of these questions, some of which are under our control, others that are not. In Europe, the authorities, the European Food Safety Authority, basically looked at a range of peoples and lifestyles and tried to estimate where are the Europeans getting their PFAS from. And you can see that went through a range of possible pathways, from vegetables to dairy products to fish and seafood, eggs, alcohol, whatever. And this chart, messy as it might be, if you look close enough, you see a lot of that is purple. And all these purple is basically fish and seafood. And by and large, 70–80% of the average exposure is through seafood. Of course, there are populations where the exposure is uniquely different because of often contaminated drinking water or being very close to a point source. But so for the average person in Europe, fish and seafood is a really big player. And the next webinar will actually dwell some more into our work on PFAS present in fish on Cape Cod. So stay tuned for more details on that one. So now I want us to move a little bit to a place that is even more scenic than the Cape Cod, if that's possible. That's the Faroe Islands. So that's in the North Atlantic between Iceland and Scandinavia. It's a collection of a dozen islands and around 50,000 people. Traditionally, they have a lot of fishing, and they also had a tradition of eating whales, pilot whales. And of course, it's a very small community, so they don't manufacture PFAS, they don't produce anything with PFAS, they just buy whatever's on the market. And so our interest was to figure out what besides the whale meat would be causing PFAS uptake for the people living in that series of islands. And while the traditional whale hunting has decreased, they keep it alive as a tradition, really. It is not the main food supply any longer. It is, of course, greatly criticized for obvious reasons. At the same time, I think the community wants to keep their tradition alive. The whales themselves are not really in any danger of being extinct, going extinct because of the whaling. This was a picture in the news. Of course, this has been controversial. Gretchen Lohmann was on the Faroe Islands. She went on a research cruise, and on the buffet were indeed whale blubber and meat. So it is still used, but mostly I think it's a tradition rather than a main staple diet these days. So with that in mind, we work with a local research team to investigate the presence of PFAS in indoor air and dust. And so because of the ongoing epidemiological work that is on the Faroes, the people are very interested. There's a lot of buy-in, so we had a lot of requests. So we ended up with selecting 40 out of 500 households. And what we did is to place a small sampling device, pictured here, in a central room in each of these 40 households. They were there for 4 weeks, and during that time, they take up PFAS from the air. PFAS get into the air typically by just being released from carpets, textiles, these kinds of products, and then are present. At the same time, there will also be captured by dust. So at the same time that we placed our samplers, we asked them to start a new collection of dust. And then after 4 weeks, we collected both our sampling device and the dust. And this particular dust is a little sandier and had a Lego salt, which I think we tried to return to the previous owner. So with that, let's go to the results. Maybe the first, and it shouldn't be a surprise, but it's so frustrating, even in the most remote islands, of course, we have PFAS. So what is shown here is the PFAS that are volatile. So we call them precursors. So they are often in the gas phase. And then the ionic, these are the ones you typically worry about in drinking water. The PFOA, PFOS, they would be the ionic ones. Shown here are the results from our work on the Faroe Islands and then compared to other European places. And so by and large, the results we have are fairly similar, certainly for the volatile PFAS compared to other European places. And for the ionic compounds, maybe a little lower than other European places, but our sampling was also in 2022, so more recent than a lot of the other studies. So by and large, there is a general presence of PFAS across Europe. Now, of course, you probably want to know how this is in the US. I picked out one study that was done in North Carolina. They measured the same compounds in dust, both the volatile compounds and the ionic. And the North Carolina homes, it was a smaller sample size, it was 11. They basically would be in the higher end. And that is not a big surprise, I think, because of the initial prevalence of manufacturing in the US by 3M, by DuPont, by some of these other companies in the US. There was a homegrown marker that was fairly widely used. Scotchgard, Teflon, all kinds of products are household names. So we think that the North American market had more products with PFAS than maybe some other markets. So the first part was what is present. And the second part, of course, now what does this mean? So as I said, exposure could be from food items, drinking water, dust, air, and there are some others that are more difficult to quantify. Now the Faroes have a unique situation because their drinking water is very clean. It's extremely clean. So that really means it's really a matter of food being a big player, and then we're trying to figure out what else is there, because we knew from prior work by Alfie Sunderland that whale meat, fish is a big, but there's something else. And so this is what we're trying to fill as a gap. So we went through exposure scenarios that are detailed and by the EPA, how you model these. Basically, you come up with a low exposure. This is, in this case, it's for a child. Low exposure just means the child has a average or below average breathing rate and doesn't ingest much dust. So the hand-to-mouth contact is not that big. And then a high-activity child, of course, has a much higher air exchange rate and ingests a lot more dust, probably just because it's a much more active child. And so we're trying to put this in comparison to what we knew is kind of a generic baseline on the Faroe Islands for those children and families that still eat pilot whale meat. And so if there is some guesstimate of how much pilot whale meat is eaten on average. As I said, not all families do this anymore. And that is about 80 milligrams per kilogram body weight per day. So we took now for a young child, this would equate to about 0.38 nanograms per kilogram body weight per day. And the question was, how does this compare to what the EU thinks is safe? Safe is a tolerable weekly intake. That's about 4.4 nanograms per kilogram body weight per week. So the next two slides I basically go through these scenarios. So if we think of a child that indeed eats the average bit of wild pilot whale, considering the child, so it's a little less, that would not take up all the tolerable weekly intake. So there's some space left. And for a low activity child, then dust and air are really small players, so they really don't contribute much. So that child should be within what the EU considers tolerable. And agreeing, yes, there's place for, kids eat more than just pilot whales. But so that was what we could play with easily. If we have a child that is on the high activity end, so more active, more hand to mouth, so more dust ingestion, then of course suddenly dust and air combine to be almost as important as the consumption of whale meat. So even in a place like the Faroe Islands, what happens indoors can contribute substantially to exposure. So that let me try to wrap this up and bring this back to where we are. So here's the puzzle of the exposure pathways we know exists. Water isn't a big player on the Faroe Islands because it's just very clean. So we're looking at uptake from air directly. That would be inhalation, indirect through dust, diet, and then the air exposure. So certainly on the Faroes, what you eat makes a big difference, and that has been known, and that's why there's actually a warning in place that women of childbearing age should not eat whale meat, and that has by and large worked. Most women indeed do not eat whale meat anymore. And initially that health advisory came because of mercury. We know also other organic pollutants like PCBs played a role, and of course now PFAS. So unfortunately, many marine mammals are highly contaminated, and they are certainly not the best food choice if you're concerned about pollutants. We also know and could verify and document that consumer products do play a role. This particular case for the work on the Faroe Islands, the volatile PFAS, so those that are neutral and can easily leave their products where most abundant in the dust and in the air. When we then looked at a comparison between what is in the air, what's in the dust, and what's in serum samples, there was no obvious match, and that is probably not a surprise given how complex exposure actually is. I think what we hope to do next, and we had discussions with Laurel over this for a while, is want to do a similar exposure assessment on the Cape, but we want to make sure we do something that is both feasible on our end and gives useful answers to people who are concerned. And by and large, maybe to just wrap this up, the products that we think are causing most of the PFAS being present in the air and dust are probably related to stain repellency of carpets and textiles. There's obviously more PFAS used, but those are the most obvious ones to release PFAS into the air and dust. So with that, I want to thank the National Institute of Environmental Health Sciences for the support of the Superfund Research Program, Fulbright Arctic Cohort 3, which enabled me and Melissa to go to the Faroe Islands, and a disclaimer that, of course, what I just presented was really our opinion and does not represent official views of the NIEHS. With that, Laurel, thank you very much, and I give the screen back to you.
Great. Thank you so much, Reiner, for that overview of your work in the Faroes and kind of connecting that to people's exposures here in the US. I look forward to getting questions about that later. Again, if you have questions for Reiner, and actually, Chris, I'll share some slides first before you're up. We'll do questions at the end. So if you have questions for Reiner, type them in the Q&A and we'll get to them after Chris's presentation. So I wanted to kind of make a little transition here from the work that Reiner was talking about in the Faroes to Cape Cod, which is where our community engagement work is based for STEEP. So I wanted to just introduce you to the issues of PFAS on Cape Cod. Again, some in our audience are based on the Cape, and we know we have many people who are off Cape. So why is it important to study PFAS on Cape Cod? So on the Cape, water is really at the heart of life on the Cape. Everyone relies on the groundwater aquifer, which is a sand and gravel aquifer, for their source of drinking water, either from public or private wells. And we know it's vulnerable to contamination given the sand and gravel aquifer and the shallow water table. There are a couple of places on the Cape where there are quite high levels of PFAS in the groundwater related to the use of AFFF firefighting foams. These occur at Joint Base Cape Cod, just like every other military base has the use of past use of AFFF has contaminated groundwater with PFAS. We also see high levels in Hyannis related to AFFF use at the Barnstable County Fire Training Academy and the Cape Cod Gateway Airport. We also have found low levels of PFAS in many places throughout the Cape, and we think one of the possible explanations for that is the widespread reliance on septic systems, which serve about 85% of residences on the Cape. PFAS have been found in public and private drinking water wells throughout Cape Cod, and this and other water quality challenges have raised concerns among community members about whether there are connections between water quality and people's health. Silent Spring Institute was actually founded because of concerns about high breast cancer rates on Cape Cod and possible connections to environmental factors. And that's one of the reasons why we've been studying water quality on the Cape. just to provide a sort of overview or timeline of PFAS on the Cape, I'm not going to read all of this, but I'll mention that I can't believe it's been 15 years since Silent Spring Institute was first to find PFAS in public and private drinking water wells on Cape Cod. That was my first project that I worked on here at Silent Spring, and happy to be part of the STEEP team that got launched in 2018. Since then, we've done 2 additional rounds of private well water testing in 2018 and 2021, with the goal to learn more about the levels of PFAS in private drinking water wells on the Cape and to understand primary sources. Some of you who live on the Cape may be aware that Silent Spring Institute is also leading a separate study called the Massachusetts PFAS and Your Health Study. I'm not going to talk about that today. It's separate from the work of STEEP, but just wanted to provide some context. The CDC and Agency for Toxic Substances and Disease Registry is conducting a multi-site PFAS health study, including communities in 8 different states. Here in Massachusetts, Silent Spring Institute is leading the Massachusetts arm of that study, and we've recruited 700 adults and 100 children in Hyannis, which is on the Cape, and Air, which is a different town west of Boston. And we've shared PFAS blood test results for communities, and we'll provide a link to that in the notes that go with this webinar for anyone who wants to learn more about that. As Reiner mentioned, STEEP has a community engagement core, which I co-lead along with Emily Diamond, who's a professor at University of Rhode Island. The activities that we've been conducting on the Cape include private well water testing, collaborating with members of the Mashpee Wampanoag tribe to collect fish and shellfish samples, and think about how to communicate those results in a culturally appropriate way to tribal members. We've been working to enhance high school education on PFAS and water quality, hosting community events, and collaborating with community partners. We have a community advisory board, and we also have 3 core community partner organizations: the Massachusetts Breast Cancer Coalition, the Mashpee Wampanoag Tribe, and the Sierra Club, Cape Cod, and the Islands Group. So I'm happy here today to be joined by Chris Powicki. I'm going to stop sharing so you can get your slides up, Chris. So Chris is the chair of the Sierra Club, Cape Cod, and the Islands Group, which is a longtime partner organization of Silent Spring Institute's research on PFAS and other emerging contaminants impacting Cape Cod's sole source aquifer. As Sierra Club's representative with the Hyannis PFAS Community Working Group, he helps raise awareness and advocate for accelerated characterization and cleanup of contaminated sites and PFAS plumes affecting communities in the towns of Barnstable and Yarmouth. Professionally, Chris is president of Water, Energy, Ecology, Information, and Design Services, Inc., an independent consultancy providing research, planning, analysis, and communication services. And if that all wasn't enough, he also teaches renewable energy courses as an adjunct professor with Cape Cod Community College. Thanks for being here today, Chris.
Thanks very much, Laurel, and thanks for your presentation, Rainer. I appreciate the opportunity to give an update on what we're working on. So first, some background on Sierra Club's Cape Cod and Islands Group. We are part of the Sierra Club's Massachusetts chapter, and the Massachusetts chapter is part of the National Sierra Club organization. We work in a lot of areas, and I think one of the great things about working as a volunteer with the Sierra Club is that you can work at the national, state, and local level and have connections with people working at those levels. Here on the Cape, we've been working on water supply contamination and toxics issues literally for decades. I want to give a shout out to my colleague David Dow, who I know is on the call, who was involved in the Massachusetts Military Reservation and Joint Base Cape Cod cleanup, and is still active. We have been, as Laurel described, a supporter of the STEEP effort for a number of years. The poster on the right shows a forum we hosted in 2016. I think at that time, PFAS was considered an emerging contaminant. At this point, I think on the Cape, it's considered a ubiquitous contaminant. We are working not only in PFAS on the Cape, especially in the Hyannis area. We also support PFAS legislation. We, on water quality and toxics, we worked with many other organizations to stop the multi-purpose machine gun range and protect the Upper Cape Water Supply Reserve. working to prevent Holtec from discharging radioactive chemicals to Cape Cod Bay. We support state legislation on plastics. We're working with Mass Audubon and local groups on a campaign to encourage adoption of local pesticide regulation. And we also monitor, comment on plans, projects, programs for addressing our wastewater challenges. And that's a big deal on the Cape, and PFAS is increasingly an important part of wastewater management and water quality improvement programs. So the Hyannis PFAS Community Working Group formed in 2023, and it includes representatives from the Greater Hyannis Civic Association and Hyannis Park Civic Association in Yarmouth. We're also able to work with a technical consultant and licensed site professional, as well as citizens from affected areas. And the picture in the middle of the screen shows us giving a recent presentation to the Barnstable Town Council. And I just want to mention from left to right, Rachel Youngling, Tom Cambereri, our licensed site professional, Linda Bolliger, myself, and then Betsy Young with Greater Hyannis Civic Association. We are I guess the biggest activity we work on is public education and outreach. And we were fortunate to receive a couple years ago an initial grant from Mass DEP, a technical assistance or TAG grant. And that allows us to work with a technical consultant and licensed site professional to understand what's going on with PFAS in the community and underneath our feet, and also to have that technical consultant represent community interests in technical meetings. And our consultant is Tom Cambereri. Again, very fortunate to have the chance to work with Tom. One of the things we've worked on is trying to get a comprehensive understanding of what's going on underneath the surface in Hyannis. And this infographic is very complex, and that's essentially a quick summary of what's going on underground in Hyannis, a very complex situation. It was produced as a public education tool using TAG funds, and it draws on data from the airport, the Barnstable County Fire Training Academy, Silent Spring, and the community, plus expert knowledge to depict the history and the current state of PFAS contamination in the area. And so just to first start with a geographic orientation. See if you can locate the runways in the middle of the map, and then also the town line at the right-hand side of the map between Barnstable and Yarmouth. Those are just points of geographic reference. And so the first thing I want you to do is look at the numbers within the circles, starting with the number 1 and the firefighter hats. These hats designate the county former firefighter training academy, where firefighters from across the Cape trained using PFAS-based firefighting foams. And then there are 2 other hats on the airport's property, and those designate sites that are under state management, but they do not represent all of the areas where these toxic foams were used on the airport property. And also shown are some additional as yet unattributed PFAS plumes. And they're all sort of commingling and converging together. Importantly, the groundwater flow in this area within the sole source aquifer essentially flows from the top left to the bottom right, from the northwest to the southeast. And so that's sort of the general direction of the plumes over time. So the plumes emanating from the county site is brown, and the ones from the airport are sort of a light purple. Plumes marked with the number 2 circles are, excuse me, they flow down gradient with the prevailing groundwater, and their estimated extent is designated by the dashed lines. We don't have a full understanding of where the plumes start and stop, or where they mix. The down gradient municipal supply wells, shown by little blue circles with red centers, and I'm trying to use my cursor to show a few of them. They tapped into the contaminated groundwater. Drinking water containing very high levels of PFAS was distributed to homes and businesses, and it also was discharged by septic systems in the Hyannis wastewater treatment plant, creating many more plumes. And these areas are marked with the number 3 circles. This continued sort of the spreading of PFAS throughout the community through the public water supply system until 2016 to 2021. And during that period, PFAS treatment was phased in at all of the different wells. As of now, treatment is expected to continue indefinitely, and that's required in order to ensure that Hyannis area drinking water supplies are safe. But legacy contamination due to PFAS-based firefighting foams is widespread in groundwater and in ponds, which are designated by water bodies outlined in red. And you can see that many of the areas are outlined in red, and the levels of contamination in them vary significantly. Household use of PFAS-containing compounds is adding to the overall burden of contamination in the area. And as shown in the areas marked with the number 4 circle, the commingled plumes from the county and the airport are converging on Mill Creek Marsh, which is located along the town line. And Mill Creek Marsh flows out into Lewis Bay. Some of the people in this room have elevated PFAS levels in their bloodstream due to historical exposures to firefighting chemicals in the local public drinking water supply. Other exposure pathways exist, such as consuming fish and shellfish or private wells, and they will continue to exist so long as the groundwater and the surface water contain elevated levels of these forever chemicals. To control PFAS at the source, the county has removed contaminated soil and capped the former firefighter training academy site. It also operates a pump and treat system, and it's using a new permeable reactor barrier to prevent offsite migration. The airport has capped its sites, but has no plan to remove soil or prevent legacy contamination from migrating offsite, even as it plans a large-scale expansion to accommodate larger planes and additional private jets. This red dot indicates a location known as the airport's deployment area site, and these blue dots show areas where we recently conducted community-based PFAS sampling led by our licensed site professional, Tom Cambereri, using grant funding from Community Action Works. And so now I want to focus on some of the things we've learned through our TAG grant and our community-based sampling. And so first, we've spent a lot of time testing the airport's assertions in its reporting to the Mass DEP. And the first one I want to talk about is that capping the site represents an adequate solution for controlling offsite migration. And this figure shows PFAS concentrations from the airport sampling immediately adjacent and down gradient to the capped site, that little red circle I highlighted on the previous screen. And what you can see is that after the cap was installed in late 2020, designated by the dotted red line, PFAS concentrations of the PFAS 6 regulated chemicals declined right away, and then PFOS present at a relatively low level also declined slightly. But over time, you would expect if the cap was working, the levels would drop, and there might be seasonal cycling with the groundwater levels. But over time, levels would be assumed to continue dropping. And instead, what's observed from the airport's data is that the levels of PFAS 6 are actually increasing directly downstream of the capped area. And levels of PFAS are also increasing in parallel. And in short, this this indicates that the airport's cap is not functioning properly. And I want to add the PFAS 6 drinking water standard for Massachusetts of 20 nanograms per liter. You can see that it's tiny compared to the scale of the chemicals that are migrating off the airport site. The second thing we looked at is the airport's assertion that the plume does not extend beyond the Mar wells, which is the Barnesville well field right on the Yarmouth-Barnesville town line. And so we conducted sampling. Tom Cambereri went out and collected samples, provided them to a lab, and we did sampling in several locations. The Mill Creek Marsh, you can see by the table that the 6,2 FTS PFAS compound, which is the signature compound for the airport's plume, essentially used by the airport to identify the extent of its plume. The concentration was 1,250 NGL per liter, and decreased from there further downstream at the Baxter Grist Mill to 34.1, and then non-detect in a nearby area of the bogs. But this shows that the Mill Creek Marsh, immediately downstream of the Mar well field, it shows that the airport's plume has extended beyond the Mar wells. It's not being fully captured by the Mar wells, and is flowing into the Mill Creek Marsh system. And you can see that the PFAS 6 levels at the bottom of the screen, the regulated contaminants, 358.2 compared to the standard of 20 in the Mill Creek Marsh, and declining as you go further downfield. But the fact is that the airport's plume does extend beyond the Mar wells. Excuse me. And that again is the 20 NGL per liter standard, and the levels are much higher shown in our sampling. And so, just in conclusion, looking again at this map, if you look to the far right-hand portion, you can see the Mill Creek Marsh outlined. And the general conclusion is that the airport's plume is not fully captured by the system at the Mar wells. It's crossed the town line into Yarmouth, and it is impacting Mill Creek out toward Lewis Bay. Earlier this week, members of the Hyannis PFAS Community Working Group presented to the Yarmouth Board of Selectmen, and as you can imagine, they're quite concerned about this plume crossing into their community and potentially out into Lewis Bay. So the Hyannis PFAS Community Working Group is actively trying to spread the word, not just through public presentations before officials, but also through outreach. And we're going to be translating and distributing our Hyannis PFAS contamination infographic to our Brazilian and Spanish-speaking communities, as well as other community groups. We're also continuing to work with Silent Spring. Silent Spring has been so important. Its steep work and its multi-site study are really foundational in connecting the dots between past historical use of PFAS, the levels found in our groundwater, and the levels apparent in blood sampling done for many Hyannis residents. And we're also going to continue to reach out, engage, and advocate to expand awareness of the potential health implications. And again, we look to experts at Silent Spring and the Mass Breast Cancer Coalition and others for information on those health implications. We also are promoting blood testing for those who've not yet been tested but are at risk of possible exposure due to drinking water supply. Generally, that's people who lived in the Hyannis area or worked in the Hyannis area served by public water supply for a number of years prior to 2016 when treatment was deployed. We're continuing to advocate for additional PFAS sampling, and we want to see an accelerated characterization and cleanup of both the airport and the county sites. And we also are actively supporting through the Hyannis PFAS Community Working Group and through Sierra Club's Massachusetts chapter, supporting Massachusetts legislation to address PFAS concerns. And I have a picture, an image from the Mass Breast Cancer Coalition that highlights current legislation up for consideration now. And I do want to give a shout out to Senator Sear for promoting the first one listed, Act to Protect Public Health from PFAS. And we also are advocating for state and federal funding to help accelerate the cleanup in this area. We also are urging, based on our work, the Mass DEP to require the airport to sample for PFAS downstream of the Mar wells, to investigate and characterize the unidentified plumes on its property, and also to commit to on-site PFAS control. And I think the key message from all of our work is that without both a blend of both community engagement and technical expertise, we're not able to make progress. And so we really appreciate the work by Silent Spring, the work of our licensed site professional, Tom Cambereri, Mass DEP support in helping us work with that site professional. And over the last, after a couple of years of working together, I think the awareness of the issues is much higher, and the concern among public officials and the efforts to seek solutions are much more aggressive. And so with that, thanks very much.
Great. Thank you so much for your presentation, Chris. And thanks to you and David Dow and Keith Lewis and others at the Sierra Club for supporting Silent Spring and Steve's work over the years. So just a reminder to our attendees, please type any questions that you have into the Q&A and we'll try to get through as many of those as possible. We have a few questions to get started with. Reiner, a couple questions for you. You talked about some of the work that you've done on indoor exposures in the Faroe Islands. There's obviously a lot of questions with respect to PFAS, but what's a key research gap that you'd like to fill next with your work?
Yeah, I think as I alluded, it's the simple question is always know what's my main route of exposure, and for a community that has contaminated drinking water, it's easy, it's the drinking water. But once that's taken care of, what's next? How long does it take for people's blood levels to drop sufficiently that they feel that they're kind of safe again, and what can they do? So that's how this work on the air and dust came about. Is that something that people could potentially do that could lower their exposure? Because having absolutely no agency in your life is not very fulfilling. So that was part of the impetus. And yes, we want to, of course, understand also on the Cape, then there's, of course, the legacy of the AFFF contaminated water. To what degree is that still present in the soil, or has this kind of all been flushed out? So I think we have exposure questions really on the Cape.
Great. Thanks for that. I'm looking forward to working on you with those questions on the Cape. Another question for you, Reiner. It's kind of hard at the news these days to avoid hearing about cuts in federal funding for research. Is there anything you can say about how these cuts might affect your work and the work of Steve?
Yeah, it's a challenging time for environmental science and trying to work with communities. Right now, the biggest threat was that NIH was going to change how much money they give beyond the research to the upkeep of universities and research institutions. And that was supposed to lower that indirect cost rate to 15%. I think Laurel and I, we had a quick discussion. I think you or I could not support STEEP any longer. I think Silent Spring would have trouble operating. So while it seems like it's a small thing, this technical adjustment of the indirect cost rate, it would basically cripple research across the country. And I think you hear the same from small or big universities, research institutions, community institutions. Beyond that, I guess with a temporary reprieve, the budget cuts have not materialized for us yet, but we don't know what's going to happen with the next budget. And of course, we've seen that Columbia temporarily at least has no federal research funding. I understand your eyes on that on a much wider list, but clearly there's a threat to academic research, and that will, at the end of the day, impact most of us. So yeah, it's not looking that great right now.
Agreed, but thanks for sharing that insight on your end. All right, Chris, I have a couple questions here. And you talked a little bit about how the work of researchers has been helping your advocacy work. What types of new research would be helpful for communities on Cape Cod?
I guess, starting in the Hyannis area, I think the work you're doing on fish consumption, shellfish consumption, as a avid oyster eater, I'm personally pretty concerned about levels in oyster and our oysters. And I know there's been a lot of work on microplastics, or an increasing amount of work on microplastics. I think it would be interesting to understand sort of the interactions of those two concerns from shellfish to human exposure. Also, on the exposure through soil or dust, sort of with PFAS from AFFF spread all over the place. Do construction projects, are they creating issues when we move from septic systems to wastewater treatment systems, which is increasingly happening across the Cape? Septic systems have to essentially be shut down, decommissioned. What are the issues associated with that? Do homeowners have any liability for what's been coming out of their septic system over years? If it came from the public drinking water supply, how do you differentiate, household PFAS from AFFF PFAS? Also interested in, people who are doing home gardening in the Hyannis area. To what extent is that a concern? The other exposure issue, I think that is Cape-wide, is what are the effects for people, or what are the concerns for people who are on private wells? The public water supplies are now tested for PFAS, and in many cases, wells across the Cape will require treatment, are requiring treatment. It's getting harder to find places for new wells. And so I think that whole issue of planning for water supply adequacy and quality is going to become an increasing issue with PFAS all over the place. And at what point, is it going to be harder to ensure an adequate supply of drinking water if we have additional development associated with the extension of wastewater treatment everywhere, and basically the growth limits that we had for a long time that were associated with septic systems requiring a 2-acre lot? Do those growth restrictions, are those alleviated, and does that put more pressure with greater growth on our water system, and how does that interplay with availability and quality considerations? So that's a quick list.
Great, thanks. Thanks for that answer. And I think you kind of touched on a couple of questions that our people in the audience asked. One about the safety of water in Harwich, and I don't know the answer to that off the top of my head. I don't know if you do, Chris, but because of the Massachusetts standard that's been in place, all public water supplies in Massachusetts have had to test for PFAS, and starting in about 2020. So there should be results out there for Harwich specifically. Chris, we did have a couple of questions come in. We're getting a lot of questions, which is great. One question was about the cap at the airport. Do you know what was used for that cap, Chris?
So one of the caps is asphalt, and another is a plastic poly material. And, I think that the caps are inspected. Apparently their integrity is not the issue. But the bigger question is, if PFAS is still detected at high levels coming out from the cap, are the caps an adequate solution? And I think, from our perspective, the answer is no, and that the airport should join the county in doing as much as possible to prevent the contamination from leaving the airport's property and entering the well fields, and then entering the downstream ecosystems and creating other exposures.
Great, thanks for that. So it seems like there's people interested in learning more about those caps. But I did also want to ask, you mentioned the airport plumes. The question is, are the Fire Training Academy plumes also moving past the Maher wells?
I think that's a great question, best addressed by a licensed site professional, not me. But I will say that the county and the airport are working in coordination with the state, much greater level of coordination now. And I think that's a positive development. For a while, I think there was sort of finger pointing on, who's to blame for the problems with our drinking water. And honestly, citizens don't care whose PFAS it is. They just want clean water, and they don't want to be under a forever threat of these chemicals. But I understand that the county is doing a much broader characterization study, and apparently the airport also is going to expand its characterization studies. And so maybe we'll have a better understanding of how far the plumes have traveled. I think it's fair to say right now that both the county site and the airport site are both concerns, and citizens, would like to see accelerated cleanup, accelerated characterization toward, sort of final solutions.
Great, thanks, Chris. A couple questions for you, Reiner. I often get questions as well from residents about home water filtration. So we've had a few questions about what types of home filtration are most effective for removing PFAS from drinking water.
Sure. So this is a nice plug to also look at the STEEP website, where we have information on home water filtration. Typically there's end of faucet installation that work well. They're typically granular activated carbon based. You can go a little upstream and go reverse osmosis. You can also do that for the entire house. I think that is certainly was more needed in the North Carolina region, where Gen X was a big problem, and that's not as well retained by granular activated carbon. So these solutions exist. And I guess the good news from the private well testing that Laura organized, most of the private wells were fine, were safe, were within limits. So that was, I think, the good news. But yes, do test and do put in a filter as needed.
Okay. And we have way more questions than we have time to answer now. But I wanted to ask a question that came in from an audience member. You spoke about sea mammals, but what about fish? Are they as full of PFAS as the mammals? And do fish and shellfish take up PFAS as readily as sea mammals?
We just had a workshop with a lot of New England state regulatory or environmental agencies. And I think the main message is eating fish is typically good for you, but yes, seafood does contain PFAS. That's, I think, by and large, freshwater fish typically is more contaminated than marine fish. So I think, I'm not an oyster eater myself, but Chris, I assume you're going to be fine eating oysters. As long as your budget allows it, you should be fine. Yeah, so I think typically I would say freshwater is worse than marine, and then marine I would still say that shellfish and oysters are probably less contaminated than long-lived, higher trophy level fish. But yeah, main message was, fish typically is fairly healthy to eat, so we shouldn't forget that.
All right, and then thinking about other exposure pathways, we did get a question if PFAS are in things with Teflon coatings, are they considered microplastics? I know you published a paper on PFAS polymers. What are the intersections with microplastics?
Sure, yeah, Teflon is a polymer, is a plastic, and yes, so it's strictly speaking part of microplastics. The production volume of Teflon-like fluorinated polymers is very small compared to all the plastics we use on a daily basis, so it's probably less than 1%. But yeah, it's part of that problem. Clearly, those don't break down fast, if at all.
All right, and bring it back to policy for a minute here. We had also gotten a question whether the EPA will still implement the drinking water standards, the MCLs that they established last year. What do you look into your crystal ball and see with respect to those standards?
In my understanding, those are still in place. Other rules or proposed rules have been gutted at this point. There was a proposed rule to limit discharges by industry in the industrial wastewater, and that has been not enforced. That is not in place anymore. I believe the MCLs are still in place, but clearly they have been sued by water providers and manufacturers. So it's going to be interesting to see how they're going to be defended in the court by an administration that probably doesn't actually believe in the science anymore. So it's going to be interesting times.
Yes, and concerning times. And I guess if the federal MCLs get rolled back, we'll go back to having this patchwork that we had before, where some states like Massachusetts and Rhode Island had standards and then other states did not, which led to some unequal protections of people. All right, we've got time for one more quick question. I guess we'll stick with you, Reiner. People seem interested in knowing more about all the different ways we can be exposed to PFAS. One person asked whether people should refrain from buying waterproof and water-resistant clothing to prevent or lessen their PFAS exposure.
Yeah, personally, I think that's the way to go. I don't think the added benefit is worth the risk, really, and the harm that it does to the environment. So yes, there are alternatives on the market for stain-resistant clothing. They're probably not quite as powerful, but I think they're probably more than sufficient. At the end of the day, it also is better for your own health, I would say.
Yeah, I would agree with that answer, and also thinking about the whole life cycle of how PFAS are manufactured and the disposal. Have to think about all of that and not just the use while the products are being used. So just to keep respectful of people's time, thank you for all the questions. We weren't able to get through them all today, but like I said, we will aim to include some additional answers when we send the follow-up email. This session will also be recorded and available on the STEEP website. And I wanted to share that we've got our next webinar lined up for Thursday, April 17th. Got some great questions during the session today about PFAS in surface water and groundwater in the Cape and fish. So we're really excited to have two great presenters coming up next month. So Heidi Picard, who recently graduated with her PhD in Elsie Sunderland's lab at Harvard. She's part of the STEEP team and did some of the fish and shellfish testing that our community engagement corps has been communicating on the Cape. She's now at Ramble. So she's going to talk about a publication where she tested for and found PFAS in fish near Joint Base Cape Cod, and thinking about which types of PFAS and how those levels vary with distance from the base. We'll also be joined by Mark Els, who's the Barnstable town manager. So please join us for that. We have a QR code here, and we'll be sure to send the link to that. And with that, thank you again so much for joining us. Again, this is the first in a series of webinars. So next month, we'll be talking about fish and surface waters on the Cape. And we plan a series in the fall with 3 more webinars that will talk about our work with the tribe, PFAS and drinking water, and some of Steve's work on PFAS and health effects. So thank you for joining us, and hope to see you next month.